Okay, so now almost 5:59. We'll start our today live section. So I think almost 39 are joined. We expect more students also. So welcome back to another new live section of Nursing Guru, and myself Soni and
myself Swarnashri.
Okay. Today we are going to discuss the post BSc first year and also for BSc
fourth year
students, and the topic is OB-GYN. So for the post BSc student, you have exam tomorrow, and for the BSc student, the exam will be on 17th. Okay, so both students get on the live and join with us. This is very helpful for you. Before starting our live section, I will ask one question. How was your previous exam? Sociology. Ma'am, did you see the question paper?
Yes, I saw.
Yeah. How was it?
Yeah, very nice. And this psychology and sociology, what we have discussed in our channel regarding the previous year question, based on the previous year question paper, what we have given, 99% of the question came exactly on the basis of that live class. Yeah. So that for sure this live will be going to get a good information, and this will going to be make sure you to get a good marks in your examination. Don't skip the live, continuously watch this live, and this will definitely going to give a proper information regarding to your examination.
Yes, that's why we are telling update with Nursing Guru, watch on each live section. You see, 99% of questions are exactly explained by Shruti ma'am and Sonasri ma'am from the previous live section. So out of 10 short essay, only 1 we missed. Remaining 9 was the same. So you can expect for your tomorrow exam and 17th exam, the expected questions we are telling which will be in your question paper. Damn sure. I'm truly telling, Nursing Guru, it's just not only a app, it's a game changer. Many people asking, where did you get the exact question? How you are confidently explaining this question? The one answer, that is Nursing Guru. Everything is there. The previous year's question paper, live classes, and also syllabus based note, everything we have. So follow Nursing Guru, watch each video, every live video. It will help and it's a miracle. Okay?
So one more thing I would like to tell you guys, that you have really attended every question in our past examination. That is what we have discussed, psychology and sociology, who all are attended our live. So if really it will be helpful, you put a comment. We will see the you can put a comment in the live chat, and this will be going to be understood by other students also. So for more sure, you can spend your your experience with your friends also. They will also get the benefit of these live classes. So we will start today a session regarding the OBG. You can see here OBG, and this initial we are going with the post basic BSc Nursing syllabus. Then after we will continue with the fourth year also, because the subject is same but the courses are different. So that reason.
We getting comments, start the class fast. We want to study like that. So no delay, we are starting. So ma'am, will we go with the post BSc syllabus?
It is not, one more thing I will definitely clarify you, it is not leaked. Leaked finally, it is not a leaked thing. It what we are assumption.
Yes.
See, what we are assumpted, that only came, and it is purely, it is previous year question paper. On the basis of that only we picked the question paper. There is no leaking, nothing. Okay, and today we will start our session. Okay. So we will go with the first foremost thing regarding the OBG. It is all about, we are going to know about regarding the pregnancy, antenatal care, postnatal care, intranatal care. So this is the thing which we are going to thoroughly knowing in the Obg Gynae. So this will one of the important subject you nurse should study in the particular courses. Okay, so when it comes to the post basic BSc Nursing, you people have 8 certain units, very important units. We can move through that each unit by unit in the this live only. So we will go with the syllabus first. Okay.
Yeah.
After that, we can go with the clarification of the previous year question papers. Along with that, we can discuss all
Important
the questions
topics,
which will definitely cover you in 1 hour. You will get the revision. Okay, so this is the thing, you have to attend the live classes. Okay, so join fastly. We also don't want to waste your
the time.
and you people also don't need to waste the time right now. It is very crucial time. So kindly join fastly. We will start the session.
Okay.
Okay, ma'am.
So from the first unit, you know the first unit is the introduction chapter. In that, the important question, the basic topic, that is the Planned Parenthood. So Planned Parenthood, we see many questions in the essay part, right? What is Planned Parenthood and the sub questions. So you have to study thorough regarding the Planned Parenthood. Clear? From the first unit, the expected essay question, that is Planned Parenthood. So this question I am telling only by seeing the syllabus. Okay, we didn't see by any question paper, only the syllabus in our hand. After completing syllabus only, we will check the question paper. So first question I am telling that Planned Parenthood. And moving to the next one.
See, here in the first unit itself, we have certain topics you should know, and this is not for sure they will not going to ask for a 10 marks questions. Okay, we can expect 5 marks or short essay type of question in this particular topic, and meanwhile you should know whatever the topics you should know in this particular unit. Very first we will go with the introduction and historical review. This is not at all much important, but you should know how this subject will be. Okay, so then only you can move with this subject, right? Then after Planned Parenthood, madam told that Planned Parenthood, that is a major important question in this. Either they may ask for a 2 marks or they may ask for a 5 marks. Okay, and when it comes to this Planned Parenthood, see the concept that couple or a woman who choose when to conceive and give a birth. Okay, before only while giving a birth, before the mother or the couple, how they have to be planned, how they have to be there to get the baby. So that is the thing you should know, and in that components will be there, objectives will be there, and the screening, certain screening test should they have to undergo. So these are all the things will be there. So you have to thoroughly know about that. The next we can go with the maternal morbidity and maternal mortality rates. Okay, this is also one of the very important. We should know that what is the difference between the
maternal morbidity and the mortality rate. Okay.
Morbidity and
mortality rate. You will get maybe the very short answer question. Maybe they will ask maternity morbidity, sometime maternal mortality. So both different, you have to be.
So the difference between this morbidity and the mortality is that morbidity, which is always going to tell us about the disease rate. Okay, so disease rate, whatever the diseases or the abnormal problems which we can see in the pregnancy and after the pregnancy. Okay, so postpartum period also, and during the pregnancy, gestational period also, whatever the problems which we are seeing, whatever the disease condition a woman can challenges, so all those things you are going to study. That rate you are going to be assessed, that is what morbidity. The next one we can go with the mortality. We know that what is mortality. Mortality means what? That is a death rate. Okay, so that death rate, there is a formula will be there for the death rate. So that and all the things you should learn and go. Then while they are asking for 2 marks, for sure you put that formula and you can come. Okay, next one is legislation related to maternal benefits, MTP Act, and incentives for the family planning, etc. Okay, this is also one of the general questions, and it is very important. Medical Termination of Pregnancy Act. Okay, according to legally, whatever the acts will be there in the constituency, in the constitution. So that is what you have to know thoroughly. Okay, so for abortion and all, we have to underwent through the MTP, Medical Terminated Pregnancy. Okay, so these are all the things you have to be know.
And family planning also. The method of family planning, there are type of family
planning methods.
That also you have to be studied thoroughly. So we can expect maybe as a short answer or very short answer question. Okay.
So regarding this MTP Act and all 5 marks also we can expect. For sure you have to study thoroughly. Okay. Next we can go with the unit second, that is a review of the anatomy and physiology. You already know this topic, and we can go with the female pelvis. This is very important type of female pelvis, and they are based on the shapes and all, and the entire female pelvis bones you have to be right if they are asking. So these are all the things regarding your practical also you have to study, and your theory purpose also there is a must and should you have to study. And the review of fetal development.
So fetal development means you have to include in that the important topics are, the oogenesis, spermatogenesis, that all topics are very important. You can expect this question for the very short answer question or the short essay answer, because oogenesis and spermatogenesis repeatedly we are seeing in the question paper. So that is including in the topic of review of fetal development. Okay, sometime they may ask fertilization also. So fertilization also we can expect for very short answer question. So that's only regarding the second unit. Now we'll move on to the...
And one more thing, in this particular unit, ma'am, they have to concentrate on the menstrual cycle also, phases of the menstrual cycle, follicular phase, luteal phase, ovulatory phase. Okay, so all the phases you should thoroughly study and go. That is very important.
Yeah, menstrual cycle they can expect from short essay answer question.
5 marks.
5 marks. So that is also important. Don't miss the question.
And fertilization, for sure they will ask for a 2 marks. Sure you have to
fertilization, implantation, everything they can expect for the
2 marks. 2 marks question. Okay. So next we can go with the third unit.
Third unit, the topic that is physiology of pregnancy. Note down, physiology of pregnancy is an important question. Important means very, very important. You can expect any part of the physiological area, and you have to study thoroughly the cardiovascular system. Okay, cardiovascular system, physiological changes you can expect for the short essay question, and in that other system also there, respiratory is there, musculoskeletal is there, and integumentary is there. Mainly in integumentary you can see what all are the changes we can see in the abdominal part. There is linea nigra, strabiscans, everything is there, so that you have to be included in the physiological changes of a pregnant woman. So that question you have to be studied. Maybe you can expect in essay some questions that we can expect for essay, also for short essay. So study for both type. Okay, so this question is important. Second, signs and symptoms and diagnosis of pregnancy. So what all are the signs and symptoms we can see in a pregnant woman? So what all are the symptoms we can predict? There will be vomiting. For that one also, that is a condition, that is hyperemesis gravidarum. So that also you can expect for a question. Once you study, take each topic from each content. So you can study in detail and answer very fastly. Okay, so symptoms, signs in that include hyperemesis gravidarum.
Amenorrhea will be there.
Yeah.
Amenorrhea, which means what? There is a absence of the period or the menstrual cycle during the gestational period or during the pregnancy. Okay, so these are the things you should thoroughly study. And meanwhile we have certain symptoms, what ma'am told. Morning sickness will be there, along with that nausea and vomiting will be there, and breast discomfort will be there, and we have a frequent maturation will be there. So these are the things which we can able to see during the pregnancy. So that will be considered as the diagnosis of the pregnancies. Okay, so women will face lots of challenges during the pregnancy. So that is what you are going to write in the diagnosis of the pregnancy.
Next one, we can expect that the antenatal care, management of pregnancy, labor and puerperium. So for the antenatal care, you have to write down what all are the care you have to give for a pregnant woman and the management of pregnancy. All this we can expect for very short answer question. In that, important one is the puerperium. Okay, puerperium we can expect as a puerperal sepsis. There are certain puerperal pyrexia is there. All these question we can expect in the short essay part. And
thoroughly you know about these 3 factors. One is antenatal,
intranatal and the postnatal.
Yeah.
You can expect management questions, management of antenatal woman or management of intranatal woman or management of postnatal woman. So both management you have to study.
Ante means before this pregnancy, intra means
During the
pregnancy, and the post means after the pregnancy, what we will call as postpartum period or postnatal period we will call now. So that is what these three terminologies you should thoroughly know, means definitely you can answer in certain way only. Okay, so for sure you have to thoroughly prepare for this antenatal management during the pregnancy. Okay, and the labor and the preparium also, each and everything. Certain signs will be there, we will call as a cervical signs, so uterine signs, Hager signs, so all those things also along with that you have to go. The next topic is
before that we are getting question that BSc students also need to watch this video. Yes, you have to watch the video, because after this topic also you can expect, but after the post BSc section we will include BSc students question preparation. So
Yeah.
you can also watch the video from the beginning until the ending. Okay, yeah, we'll move.
So the next topic is women, the pregnant women with HIV or AIDS, any contagious communicable disease which will be affect the woman during the pregnancy. By the time whatever the certain measures you have to take to care the particular woman, especially if the person or the pregnant woman affected by the HIV, we will have a certain separate labor room in the hospital. Why? In order to reduce the spreading of the infection for the other also.
Okay.
So this is the measures which we have taken, right? And that management you have.
This question we saw in many question paper as a essay question. Essay question like pregnant woman with HIV AIDS. In that sub question are there, and short essay also it asks that the management of a pregnant woman with HIV and AIDS. So you have to write the management. What all are the management you are giving? That the madam said, like the delivery time, what all are the precaution you are taking. After the delivery, what all are the precaution you are taking. You know that after the delivery for the baby there are certain medicine we have to administer for the newborn. For what? To stopping the spreading of the HIV or the AIDS transmission. So like that you have to answer. So note down, this question is very important, you can expect for the examination. Clear?
So in this unit only for sure continuously focus on the labor also. Okay, so that is also one of the important topic. The first stage, second stage, third stage, 3 stage continuously they will ask. Okay, so sometimes they will ask individual stage. Okay, explain second stage of labor. Okay, suppose the X and Y admitted to the hospital. In the second stage, you briefly explain
like
the second stage.
36-week primary gravida woman admitted to the labor room. What is the initial management you will plan as a nurse, and you have to write the nursing management, diagnostics and intervention, everything you have to include in your answer sheet. Okay, so mainly this chapter, like you need to study like antenatal woman, intranatal woman, postnatal woman, all the 3 stages of management. In the intranatal period you have to include the first stage of diagnosis, first stage of labor, second stage of labor, third stage of labor. In that third stage of labor is important, because third stage of labor the management is coming. In that only the complication of delivery also you can include while studying. What are the complications we can expect? There is PPH is happening and perineal laceration. Lot of complication also coming during the intranatal period. So like that include each topic in a subject and study. And postnatal, what is the postnatal? After the delivery the care we are giving to a woman. You can include the baby care, immediate management of a newborn. So like that a topic is we can complete. Clear? Okay.
So we can remember in a very easy way this mechanism of labor that I will tell now. Engagement, descent, and we have a flexion. After that, internal rotation of the head will be happen, crowning and extension. After that, restitution, external rotation, and expulsion of the fetus from the mother womb. Okay, so this is the process which will be happen. Okay, this
the
one you are going
mechanism
to
of labor.
This one you are going to study through your textbook. It will be like this much of content. Okay, so if you sitting for this live, kindly have one pen and paper with you, and once more I will repeat it, this one, and you can take down. Okay, so the first step is engagement. After that, descent will be happen. After that, flexion. After the fourth step is internal rotation. Okay, after the internal rotation, the crowning. Okay, head will be fixed. That is which will be called as crowning. Okay, so after that, what will be happen? Extension. Extension will be happen. After the eighth step is external rotation. Okay, after that, expulsion of the baby or the fetus will be happen. This is the mechanism of the normal labor. You should know. This one is very important. They will ask for the theory also. They will ask for a practical also. Okay, so this is the thing. Next we will go with the fourth unit.
That's a newborn care. First one, that is the newborn baby. So you can expect the immediate management of a newborn baby. You also know that what all the care we are giving immediately. Thermoregulation is there, suction is there, and breastfeeding we will start, mother to mother contact. So there are certain newborn care after the delivery is there. So you can expect a 5-mark question from the newborn management or immediate newborn care. Okay, and next one is a care of the baby at the birth, including resuscitation. Yeah, same like that. It is an immediate management of a newborn, because we have to check the baby whether the baby have any grunting, the baby is going to any respiratory distress syndrome. So we have to, how we will assess the newborn baby. You know the Obg score. Okay, the appearance, grunting, everything you have to assess. Obg score means there is a score 10. 3 to 4 is a moderate and the severe score is there, and no response means that is a very complicated period. So like that we have to observe the baby and take immediate action. That is the management. What all are the management we can give to a newborn baby? Clear? Like that you have to answer for that question. And next one is the essential newborn care. Yeah, everything. These three are the
Somebody
same
else
one.
texted that entire syllabus we can't able to study now. Okay, so we are not studying the entire syllabus. Okay, understand that we are just roughly
Giving the
going.
topics.
Okay, roughly going, because this will make sure you two should not skip any kind of topic in the particular subject. Okay, so if you are not knowing the syllabus, syllabus is the blueprint, syllabus is the framework. Okay, so that will going to definitely affect on your exam. So we are just giving the hints. Okay, after
Only
that we
the
will discuss
important
the
topics we are telling.
Yeah.
Not, we can also include all the syllabus in this 1 hour video. So listen that this is the only expected question topics we are explaining. After this we will tell the essay question, short answer question and very short answer question. Before getting that you have to be aware of the topics. That's why all this explanation. Okay, so and next one is the feeding. So feeding means, you know, breastfeeding. You can expect a question that importance of breastfeeding. Okay, importance of breastfeeding is repeatedly asking question. You can study that one.
Yeah, breastfeeding. When it comes to the breastfeeding, you should thoroughly
There is
know at
immunoglobulin.
what time after the birth a mother should feed the baby. See, these are the very important. Mention in your introduction part, or you can write in the objective part also. Okay, so highlight that part. So when you are writing the examination, when you are writing the answer, presenting by the time. Okay, and the next thing, you have to write the advantages of the breastfeeding. Why? Because that is the only nutritious things which we can provide to the baby by the birth time. Okay, so till 6 months, that you know, right? So this is how you have to explain and elaborate your answer. In that also you have to write the techniques of breastfeeding. Okay, so that is very important. How to hold the baby. Okay, which position the mother has to give, because primigravida means the mother not have sufficient knowledge regarding the breastfeeding and all. By the time being a nurses, you have to educate them. That is one of the very important. You should thoroughly know and you have to represent in your examination. Next one is
Jaundice and the infection. So jaundice, you all know, like after the delivery we are checking baby blood sugar, total bilirubin level and indirect bilirubin level to identify whether the baby have jaundice or not. So you have to elaborate what is the neonatal jaundice and the management. So the mainly the management is including phototherapy. Phototherapy we are calculating by using mother week. If the mother is delivered towards 37 week, the value is different. 38 week, the value is different. So phototherapy is the only management, and along with phototherapy, breastfeeding is also important. Okay, that is in coming in the jaundice. And
next one is we can go with the intensive care of the newborn. So that is very important. Means for premature baby and all, we have to provide intensive care. Okay.
Preterm baby management also.
And all will be there, no? So that management you can go with this intensive care. And trauma and hemorrhage, if any kind of trauma which will be happen during the labor, and if any trauma in the sense injury, okay, or any kind of hemorrhage will be there, which we can see after the birth in the baby. So that you have to manage. Okay. So that is also you have to thoroughly study in this particular fourth unit. Next we can move with the fifth unit, that is management of the abnormal pregnancy, labor and puerperia.
So mainly what all are the abnormal pregnancy we can see? Abnormal pregnancy, there are certain diseases are there we are studying, that is abrasio placenta is there, placenta previa is there, and in abnormal pregnancy we can include the gestational diabetes, there is conditions also there. Gestational diabetic mother is there. So you can expect a question, management of a mother with a GDM, or hypertensive mother, how the management.
Eclampsia.
Yeah, what all are the medication you can administer for a mother with a hypertensive. Main important, I think, the preeclampsia, right? Preeclampsia, eclampsia, these questions are very important. So management of abnormal pregnancy is an important topic. There are certain disease conditions that you have to be studying.
See, one tip I will tell now. Do one thing. See here, the management of abnormal pregnancy, abnormal labor, abnormal puerperium, like that only they have given the syllabus. You do 3 column and list it down the disease condition what we can see during the pregnancy and during the labor and during the like postpartum puerperium. Okay, so that you see, and each and every condition you study. Okay, according to the causes, signs and symptoms, why it will be happen, what is the management. See, that will make sure you to easy to know the answer, right? If you are going tomorrow examination, just
review only that paper.
Turn, just see and turn, definitely you will go on right. Okay. So I know that much smart people you people.
Yeah, you are more smarter than us, so you can do this. Okay, so next we'll move on to the topic abortion, ectopic pregnancy and vesicular mole. Okay, for this you can get a short essay, that is the type of what?
See,
abortion.
Ma'am, 1 second. Approximately at what time we will start 4th year? See, this is the first part, right? Once it will be finished, next second itself we will start the 4th year. Okay. So we'll go with the next one is abortion, ectopic pregnancy and vesicular mole. See here what it will be happen. Abortion means what?
Abortion, there is a different classification are there. There is complete abortion, incomplete abortion, missed miscarriage, and there are certain classification. You have to study each type of abortion. We can't expect that this one only will ask for your exam. No, we can expect maybe incomplete abortion, or maybe we can expect complete abortion, or missed miscarriage, threatened abortion. All are different. So you can study what is mean by threatened abortion, what is the clinical features, and what is the management. Some abortion we can treat and still the mother can carry the baby and she can deliver, but some abortion we have to be do some management, that is DNC or DNE, that is dilation and curettage. Okay, so like that we have to be write the exam. Also there is medical management, we can give misoprostol, so that is cytotec, that is a medical management, which drug we are using to termination of the baby, that is a cytotec or misoprostol. Clear? So study abortion and the classification, the signs and symptoms, and management of a pregnant woman with threatened abortion or complete miscarriage or incomplete miscarriage. Clear?
So this is the thing you have to study, and urinary infection, urinary tract infection, antepartum hemorrhage will be there. During the pregnancy, there may be a chance to get some kind of bleeding, uncertain bleeding will be there. Okay, so that and all how to manage you should know. And abnormal labor, okay, due to the malposition and malpresentation of the fetus, there may be a chance to get any kind of abnormal conditions during the labor. So this is also one of of the important. And
in that malposition you can expect mainly breech delivery. Okay.
shoulder dystocia.
Yeah, shoulder dystocia, that's a complication in the breech delivery. So study well regarding breech presentation and the management of breech presentation, also shoulder dystocia.
Then next one is disorders of puerperium.
Okay, disorders of puerperium. What all the disorders are coming in puerperium? After the delivery, certain infection, or you have to be do a proper care for a woman with a perineum. Okay, after the delivery, perineal care is very important and the management. Otherwise, there is a chance to get the infection. So you have to study the disorders with the puerperium. Clear?
And management of the engorged breast, okay, so, and
Breast
cracked
engorgement.
nipples and breast abscess and mastitis, infection and inflammation of the breast. Mastitis means, so these are the things the mother should not know by any kind of things which is related to the breastfeeding during the time what it will be happen, which is breast engorgement and all will happen. So these kind of things how to manage, okay, so that is the thing you have to educate the mother to feed the baby. So this is how you have to study thoroughly regarding the breast engorgement and regarding the mastitis also, infection and inflammation of the breast and crackled nipples. These are the, if they can ask what are the breast disorders which we can see after the birth, like that kind of 2 marks question also we can expect.
Next is
postpartum hemorrhage.
Postpartum hemorrhage and puerperal sepsis. Okay, puerperal sepsis also we before said in the puerperal disorder. Okay, that also we can expect, and the postpartum hemorrhage. So postpartum hemorrhage is an important topic. The management, we can expect the management of a woman with a postpartum hemorrhage. And next question is inversion and prolapse of uterus, obstetrical emergencies. Okay, as we all know, after the delivery, the uterus is going back to the normal position, that is the involution. So we have to assess the uterus after the delivery, whether the uterus is go back to normal position or still it's enlarged. That can lead
Or
to,
it is in the same position.
yeah, same position, or it can lead to some many complication. So that is you have to include in the this question, and that is leading to the obstetrical emergency. So that question is clear. We'll go a little faster because all are waiting for the questions. We have to cover the 4th year BSc also. And
next we have drugs in obstetrics, that is all related to the obstetrical pharmacology. You study by yourself only regarding the certain drugs which we are using during the pregnancy. And
yeah, note down, you can get only the important drug, that is oxytocin. Okay, many question, only the drug they are repeatedly asking, that is oxytocin. Note down oxytocin. The usage, the administration, and after administration we have to observe the mother. Okay, how much we are administrating and any contraindication. Many drugs that have contraindication. So you have to study any contraindication for oxytocin. So study well regarding oxytocin for the obstetric question.
And effects of the drugs during the pregnancy, labor and the puerperium, that what I told you, know, during the pregnancy and the postpartum period, and in the intra also labor time also, what are the effects which will be caused by the certain drugs during the pregnancy. Okay, so these are all the things you have to know in the 6th unit. Now we can move with the 7th unit, National Welfare Programs for Women, National Family Welfare Program, infertile couple, problem associated with the unwanted pregnancy, unwed mothers. Okay,
so these are the topics coming under national welfare, like women welfare program. Okay, in that certain
to provide
program,
a certain strengthen to the women, the
Mother
government
and
of
baby.
India, either it may be a nutritional help, like they are providing nutritious things to the pregnant women under like
and
Anganwadi
program for
center.
infertility
Yeah.
mothers, everything coming under the last unit. Okay, so these are the summarized section of your post BSc syllabus.
Next
Now,
one is
next
7th unit.
7th we finished. Okay.
Only 7 units are there.
So this syllabus we finished, and we are starting with the question preparation. So clearly note down the questions, and you know that what all questions we are telling, that are that will be in your question paper. So
And
don't
that
miss.
questions surely we are taken from our previous experiences
Yes.
and previous year question papers and our own analysis by the expert. Okay, it should not be leaked.
We are not leaking any questions.
Because Rajiv Gandhi University will never release the question paper before one day of the examination. It will always release before 10 minutes, 5 minutes before the examination might be. That also I don't know. So this is the thing, there is no leakage will be there.
This is the only proof. What all the questions we taught, that all we put in tick mark. You can see only one question from short essay we missed. So don't miss each question we are telling. Note down again and again I'm telling. Note it on because you will get these questions. Okay, you can pass easily, guys. See, when we are studying, we don't have any facilities like this. So use all these things and study well. Pass your exams with good score. Everyone will get surprised with your score. So we'll move on to our question paper. We'll start with the essay question. Okay, so the essay question, first expected question we are releasing. Okay, move on.
Define forceps application. Explain the indication, procedure, maternal and fetal effect of forceps application. Describe the nursing care of mother undergone forceps delivery. See, option A, three subtype question will be there. First one, you have to go with the define forceps application.
So what is a forceps application? That is, you have to define. It is a procedure where an instrument called obstetric forceps is applied to the fetal head to assist the delivery during the second stage of labor. So it's an instrument that is used to deliver the baby. Simply, that's only.
Any kind of consequences which we can experience during the labor by the time. So you have to use the forceps and we are delivering the baby in the second stage. Okay.
Yeah. And what's the sub question B? That is the indication. So what all the cases we are using this application? Note down. Mainly it is using for prolonged second stage, maternal exhaustion, fetal distress,
specific medical conditions like the mother is suffering with any kind of heart diseases or the fetal is suffering with the respiratory distress. By the time we are using this. Okay, the next one we are going with the
procedure. How the procedure is happening? Again, same like that, madam. Before explaining the mechanism of labor, once the fetal head is engaged and the membrane get ruptured, cervix fully dilated, bladder emptied, proper application of the forceps should be used at this time. Okay, and we are using the forceps and the slide of the fetal head and traction applied by coordination with the uterine contraction.
And we are releasing the baby.
So that's only the procedure. Simply we explain.
Fetal head engagement, once it will be happen, after that membrane will going to be ruptured. After that the cervix is fully dilated. After we are seeing the bladder empty, the proper application of the forceps to in order to reduce the complication in the second stage to the mother as well as the baby, we are using this procedure. The next one, we can see the maternal effect and fetal effect. When it comes to the maternal effect, we have see the perineal tear. Okay, so there may be a chance to tearing of the perineum. And next
perineal tear and the laceration, everything can happen. According to mother, that's only, and fetal, there is a bruising. We can see in the face, bruising is there, and sometime baby head. While applying due to the vacuum pressure, we can see capute on the baby head. So these are the effect for the mother and the fetus. And going to the sub question C, that is describe the nursing care for mother undergone forceps delivery. So this is the last sub question of the first question, that is the management. So what all are the management you have to give? Important thing, you have to monitor the vitals closely and you have to assess the lochia. What is lochia? That is a blade, and there are certain type of lochia are there. Rubra is there, albicans is there. So like that you have to answer. And next monitoring, that is
discoloration of the
discoloration, and
that is lochia rubra.
Next is the monitoring of the urine output. So urine output you have to monitor next what we have to monitor, inspect and care for the perineum. So like that you have to answer management, immediate management and care you have to include.
Add
this
with that nursing management.
Nursing management. So that is the last question of the first essay. Clear? We'll move on to the second question, that is
Define breech presentation. A presentation where the fetal buttocks or the feet present first at the maternal pelvic inlet instead of cephalic presentation, means head first presentation. Second question B. In that only B. Explain the types, causes and complications of the breech presentation. This is very important question. Breech presentation, for sure there may be a chance to get in the 10 marks. Okay.
And type, what all are the type? There is a frank breech, complete breech and floating. These are the type of breech delivery. Causes you have to include prematurity,
Polyhydramnios,
placenta previa, uterine anomalies, multiple gestation, hydrocephalus, everything is coming under the causes. And the complication, what all are the complication is expected? Prolapsed cord is there, difficult labor is there, birth trauma, perinatal asphyxia. So these are the complications. So second part of the second question completed, and the third
sum means C. Describe the
Burns
Marshall's method of breech extraction.
Yeah, in breech delivery there is a certain type of extraction, that is a Burns Marshall method. So you have to elaborate in the third part. It means it's a technique used to deliver after coming head in the breech delivery. The baby body is allowed to hang by its own weight for few moments until the nape of the neck is visible below the symphysis pubis. Okay, clear. This is the method we are using for Burns Marshall method. Clear? This is the second question. What is the second question? That is breech presentation. Clear? Shall we move on to see third essay question?
Ma'am, everybody is asking this is fourth year or this is post basic. Both are same only. Okay, same questions only will be there in fourth year also. Listen to this. After finishing of this, we will definitely move to the particular specifying fourth years.
Yeah,
wait for a while.
Fourth year also can listen this one. By making
normal mechanism of labor same in fourth year also, post basic also. There is no change.
Yeah, breech delivery is in BSc and post BSc. So
same only.
Specifically we are telling for fourth year also, but you can listen this question also, because you can also expect all this type of question. And the third question, that is define rupture of uterus. Define rupture of uterus, and the sub question B is explain the
pathology and diagnosis of the uterine rupture.
C question
will be there. C is that describe the medical, surgical and nursing management of the uterine rupture.
So you have to write three management. First you have to write nursing management, medical management and surgical management. Okay, so in that first you have to write definition for a uterine rupture and explain the pathophysiology. In that include the causes. What all are the causes can lead to uterine rupture? What all are the causes we can expect? That is previous cesarean section, any scar, tenderness, like that we can expect as an indication for uterine rupture. And diagnosis, how we can diagnose this? There is a sudden sharp tearing abdominal pain will be visible by the pregnant woman, and they can feel a maternal shock, that is hypotension or tachycardia is the clinical significant sign visibly we can identify for a uterine rupture woman. Next, there will be fetal distress. And how we can identify by fetal distress? There is tachycardia will be there. We can monitor it by CTG. So like that you can include in the diagnosis part. And medical management. Medical management, in that we have to start the IV fluid, blood transfusion and oxygen therapy. Surgical management. What is the surgical management? Immediate exploratory laparotomy. That is the surgical management. And nursing management. What is the nursing management? We have to give there will be 2 large bore IV line should be in patient hand, and we have to administer IV fluid, blood transfusion and monitoring of the vital signs. Clear? Like that you have to answer for this question. Clear? Okay. So we completed three essay. We'll move on to the second.
Before going to that, we will see that we have to answer 2 long essay. Okay, 2 long essay in your paper. Okay,
You will get 3 essay, but only for 2 you have to
10
answer.
marks question, 2 will be there. You will get 3. Okay, that 3 also we are discussing. Okay, in that 3 only 1 question will come. Okay, in that 3 means whatever we are discussing, no 3 questions.
Yeah.
In that only 3 questions will come. In that 2 you can answer easily. Okay, so which is very familiar to you, which is very knowing to you, that you can choose.
Okay. So next essay question, that is define pathograph.
Pathograph.
Okay. From pathograph you can expect essay question, and the sub question explain how you will use pathograph effectively during intranatal period. You know, intranatal period is the active phase of labor. So complete monitoring should be, we have to record it in the pathograph. And sub question, for that there is no C question. You can only expect define pathograph and the use of pathograph in the intranatal period. A question and B question. So how you will monitor? So in that pathograph means it's a graphical record of key maternal and fetal observation. In that contraction will be there, vitals will be there. And how you will effectively monitoring during intranatal period? We are plotting the graph. Okay, by plotting we can identify the contraction level, how long the mother getting the contraction, like within 2 to 3 seconds how many contractions she is getting, and the duration of contraction. While increasing the timing, the contraction also increasing, like 2 minutes maybe the contraction will be 5 seconds, 5 to 10 seconds, or during the last period of labor the contraction will last to 10 to 50 seconds, 50 to 20 minutes, 50 minutes to 20 minutes, like that the contraction will be last. So that you have to include in your pathograph. We'll move on to second question.
What is a newborn care?
In that sub question, explain the immediate care of a newborn. See, this we discussed already in the syllabus based topic. That's why we are telling watch the video from first, because syllabus we explain. See the question also in the question paper.
You have to go thoroughly.
Yeah, in that what is newborn care? You have to give an introduction regarding newborn care and
the definition
of newborn care. And sub question is that
explain the immediate care
management.
for the immediate care for the newborn. Establish a respiration, warmth we have to provide.
To be explain the management and elaborate each immediate care. Clear? We'll move on to the next question, that is ectopic pregnancy. Remember, we already told you that ectopic pregnancy, it was in the syllabus, it's in the question paper also. So you have to answer what is ectopic pregnancy. Give a definition for ectopic pregnancy, and the sub question is what type of ectopic pregnancy. What are the type of ectopic pregnancy? There is tubular pregnancy is there. So you have to mention what all are the types and elaborate the types of ectopic pregnancy. Sub question C, that is plan the post-operating nursing care of a woman with the ectopic pregnancy. So as you all know, if the woman is pregnant with the tube, we have to do some immediate surgery. Otherwise, what will happen? The tube will be rupture. If the tube rupture, it will cause to bleeding.
Yeah.
Yes. So immediate management is very important. You have to give medical management, surgical management, and nursing intervention. Nursing intervention you can include the vitals, monitoring, medication administration, everything. So the question is clear regarding
Pre-operative, post-operative. If the ectopic pregnancy will be there, means far most we are going to be
the
clear
NPO.
that fetus. Okay, so why? Because it is doesn't in the endometrial cavity. Okay, it is always out from the uterus. Okay, so it will be growing in the tube. So definitely we are going to remove the fetus. For that reason, surgery will be happen sometimes, or sometimes abortion will be taken place. By the time we always provide a very crucial kind of care, so that you can mention in your management, nursing management.
Okay. So next question we are moving, that is define normal labor. So see, labor also important question.
Mechanism of the
Labor. So the question is, first one, define normal labor. So you have to give a definition for normal labor, and in that sub question explain the physiological changes. So physiological changes of first labor they asked. So you have to explain what all are the physiological changes coming in the
First
stage. What all are the changes coming? First stage of labor we can expect it's in the breast changes and abdominal changes. Abdominal girth is increasing. There is a lactation production started to happen. Like that you have to elaborate the physiological changes. Other than that, you can include uterine contraction, cervical effacement and dilation, formation of upper and lower uterine segment, and formation of bag of water. These all is coming in the physiological changes of first stage of labor. Clear the question? And we'll move on to, can we move on to the second question?
And list the causes of anemia during the pregnancy and describe the management of iron deficiency anemia. This is one of the very usual things which we can see during the pregnancy in the adolescent women.
Yeah. So you all know what is the causes of anemia. There are mainly different type of anemia also there. Iron deficiency anemia, folic acid, vitamin B12 deficiency. So mainly we can see the blood loss.
Pernicious anemia.
Yeah, blood loss also can lead to anemia, that you have to include, and important is the management. So management you have to include, first you have to include the prophylaxis. Okay, prophylaxis you have to be mention the iron and folic acid supplementation. You all know once a woman is pregnant we are giving the first medicine, that is iron, calcium and folic acid. Okay, so the important one is iron and folic acid supplements. Then the treatment you have to be elaborate. In that you can include oral iron therapy, that is a diet management. You can include the iron rich food, calcium rich food, like that you can include. Also parental iron, like we are giving
parenteral iron used if oral therapy fails in iron, like very deficiency will be there, means
iron injection we will give. At last only, if it's not managed by the oral intake or IV intake only, we will go for the blood transfusion. It only give if her HB level is below 8.5. Other than we will give IV therapy. Clear? Like that you can answer the management of anemia.
For fourth years also it is very important. You can see this content. The next one is describe the management of assisted breech delivery. Assisted breech delivery involves the aiding the mother with the delivery, not a fully extractions. Okay, so that is one of the question already we have discussed regarding the breech delivery and their stages: delivery to the umbilicus, delivery of the arms and delivery of the head. Okay, so this is how the goal and all. You should be enlarge your answer. Next question paper, next questions we can move.
Okay, in that the question is define abortion. See, again coming as a repeat question. We already informed abortion is an important topic. So it's again coming, define the abortion and causes, type of abortions, explain the management. mainly they are focusing on the threatened abortion in this question. So clear the importance of studying each question.
Yeah.
So not elaborating one more time with the abortion because we already explained the abortion part. So we'll move on to the
Second question.
next question.
Define puerperal sepsis. Any bacterial infection of the genital tract occurring between the rupture of membranes or a labor and 42 days postpartum, characterized by a fever of 38 degrees Celsius or higher on any two of the first 10 postpartum days, excluding the first 24 hours. This is the A question. Next one is list down the puerperal infections. Okay, so the C question is explain the management of the mother with the engorged breast. Okay, so the puerperal also we have to, puerperal sepsis of to explain here, and the breast engorgement we have to explain thoroughly in this particular question.
And the next question, that is what is infertility? Sub question, write the causes and diagnosis of infertility. Sub question C, explain the medical and nursing management of a couple with infertility. Can you see each question there is a definition, there is a causes and diagnosis, and sub question C, every question will be the management. So like that you have to study. So what is infertility? You have to give a definition for infertility, and the causes, how the causes happen. Mainly both men and women, there are separate causes. For female, there is any ovulatory disorder like PCOS, PCOD, tubular factors. Yes, that all can indicate as a cause for infertility. For male, what is the causes? That is low sperm count or poor sperm mortality. Mortality. All this can be the causes for both men. So make a column for female causes and male causes. After that, next question is what? Diagnosis. What all are the diagnosis? That is a hormone assessment. Okay, in that FSH level we will check LH, prolactin, thyroid, and ovulating tests are also there. So like that you have to answer for the question. And C part, that is the management. What is the management you have to give? In that medical management is there, surgical management is there, and nursing management is there. Like that you have to answer for the management question. Okay, mainly nursing management means what all are the care as a nurse we are giving. Provide. So that time you just think I am a nurse, so from my side what all are the care as a nurse I am giving. Write down in your answer sheet. Clear? And we'll move on to the next questions.
Next important questions. Next three long essay. So explain detailedly physiological changes during the pregnancy. Again repeated. Again the second question, which is going to be tell about the postpartum hemorrhage, PPH. List down the causes of the PPH. Explain in detail nursing management of the PPH. Okay, so that we can see now.
In that see, we already explained physiological changes. Which part we can't expect, but cardiovascular is important. That the same
each and
question.
every systemic wise you go. Whatever the systemic changes during the pregnancy, that we can see. So that is what the physiological changes during the pregnancy. You go through that. That already explained. Now
This question came in essay part. Like what is the physiological changes and explain detail. But you can expect this question in very you can expect this in short essay, like single system they will ask. Explain regarding cardiovascular system changes, explain regarding respiratory system changes. Like that also we can expect. So each topic is very important. In that, write physiological changes and mention what all are the changes happening in the cardiovascular system. Clear?
Now we can discuss about the postpartum hemorrhage. Excessive bleeding from the genital tract after the birth of the baby, defined as the blood loss of 500 ml or more flowing a vaginal delivery or 1000 ml or more flowing in a cesarean delivery, we will consider as a postpartum hemorrhage. Okay, so here the causes are like tone, trauma, tissue, means uterine anatomy. Most common cause of failure of the uterus to contract. This is the one of the most cause we can see in the PPH. Then any kind of laceration or the injury which will be affecting the cervix or the vagina. And the next one is thrombin. Coagulation disorders, if the mother is suffering from any kind of coagulation disorder, that is also one of the cause. So these are the cause you should mention. And the C question, in detail nursing management, immediate action you have to take. Okay, immediate care we need to provide. Resuscitation sometimes needed, and we have to provide a fundal massage. Okay, fundal massage therapy, and administer the Eutronics, oxytocin, misoprostol. These kind of drugs we have to administer in order to prevent the loss of blood. And identify the causes, blood products, and documentations are the care which you have to provide as a nurse.
Okay. And next question, that is same from the part of anemia.
See, anemia and physiology 2 times repeated. Okay, the next third question is define anemia in the pregnancy in a condition where the hemoglobin. The next one is enlist the causes, symptoms, complications of anemia in the pregnancy. The C time is management. C time it is a management. Next we can go with the
next one is the atonic postpartum hemorrhage. Define what is atonic postpartum hemorrhage and list down the causes of atonic postpartum hemorrhage. Sub question C is explain the role of nursing management of atonic PPH. Clear? So for this you have to answer what is the
atonic postpartum hemorrhage
and list down the causes of atonic postpartum hemorrhage. And last the management, nursing management. We don't have that much time, that's why we are fast, because many of them asking where is 4th year BSc question, 4th year BSc question. Here this one also you can expect, so you just listen this also, because repeatedly getting questions, no. So we will start that one also, specifically explanation, but watch this one also. So that question is clear regarding atonic postpartum hemorrhage. Define what is and the causes, at last the management. We'll move on to the second question, that is define preeclampsia. See, preeclampsia is a question, it was there, so it is important one. And in the sub question, that is ensure the clinical features and complication of preeclampsia. What will be the clinical features? There will be features like elevated blood pressure, proteinuria, edema, headache, visual disturbance, and epigastric or right upper quadrant pain. And what all are the complication? Complication there will be both for maternal and fetal. For the maternal we can see that is HELLP syndrome. HELLP syndrome means there will be hemolysis, elevated liver enzyme, low platelet. Okay, and acute kidney injury, and last the important complication, that is a PPH. That's why they ask as a C question management for the PPH. Clear? So you have to answer the nurse's role in the management of a PPH. So what the management you will give? You have to give the antihypertensive drugs. What is that? Labetalol is there, nifedipine is there. If with the oral medicine, if it is not substituted, we have to start the magnesium sulfate transfusion. Okay, so that is the medical management we have to be immediately started. And yeah, like that you can answer. We'll move on to the next question.
Define hysterectomy, the and list the types of and indications of the hysterectomy. And we have a C question, explain the preoperative preparation of the hysterectomy. This already you have studied in the female reproductive system disorders in MSN also in the this year only. And next we want to explain this one thoroughly.
No, because give a definition.
It is a removal of the uterus and the cervix, which will called as a hysterectomy. Okay, so for this management, pre, post, and intra you can add. Okay, the pre we have 5 P's: physical preparation, physiological preparation, pathological preparation, psychological preparation, and preoperative preparation. Okay, so this is how you already studied. Not like this only you go. This is also one of the very important. Either they may ask for a 5 marks also. Define and explain the management of the hysterectomy. They like that also they can ask. Okay. The next one is
Define puerperium.
Yeah.
See, again the puerperium question is coming. So you have to define what is puerperium and explain the pathophysiological changes that takes place during the puerperium. That are the two questions from the puerperium part they are asking. And the second other essay question, explain the minor disorders of pregnancy. Sub question B is discuss the role of midwife in educating pregnant woman about the antenatal care and diet. See, antenatal care again come in the question. So we have to answer for the question that is minor disorder. What all are the minor disorders? It's coming in there. Mainly that is lochia will be there, uterine involution is there, and vaginal involution, cardiovascular system, hormonal changes. Like that you can answer. And in the
second question, explain the minor disorders of pregnancy. And next one we have two. In that only B type question, discuss the role of midwife in educating the pregnant woman about the antenatal care and the diet.
Right.
That is you all study in community also. Here also you need to study. Okay, only two A and B question in the second. So thoroughly you going with the antenatal care. Okay, they are asking only educating. No need to write only the education. Okay, you have to thoroughly write about the antenatal care. After that, the role of nurse, how she should educate the pregnant woman in the antenatal, that you explain. Okay, and the common non-life threatening discomforts and physiological changes experienced by the pregnant woman, for example nausea, vomiting will be there, morning sickness, we will call those are a morning sickness, heartburn will be there, and constipation she should experience, backache, leg cramps, hemorrhoids, and we have varicose veins and other things. Okay, the carpal tunnel syndrome and all we are going to be the pregnant mother will be experienced during the pregnancy. Okay, these are the things you elaborate your answer while writing, and you just go with that. The next third question is, what is ectopic pregnancy? And next one, enumerate the signs and symptoms of
again
the
repeating answer.
And next one is, explain the management of the patient with the ectopic pregnancy. Okay, it is repeated. Kindly fast show, there may be a chance to get this question.
So we will just write what all are the topic expected from the essay question. So I will just, they can also only the topic.
Okay, ma'am. See.
So we discussed first one is the forceps application. So expect it as a essay question. And next one is a breech presentation. So note down, it is a repeated question. So that's why we will put a plus mark over there. And which was the next question? That is define
Breech presentation.
Yeah, breech presentation is the question repeated. Next question, that is rupture of uterus. And next essay question, that is define partograph. Define partograph. Next, what is newborn care? Newborn care. Next one, ectopic pregnancy. Normal labor. Anemia. And abortion.
Abortion and its types and management also will be there.
Then puerperal sepsis. Infertility. PPH. Then what is the next question? Eclampsia.
Physiological changes.
Physiological changes. Then minor disorders of pregnancy.
That only will come.
And abortion. So in that
Abortion.
you can see repeatedly asking question, that is breech presentation repeatedly asking. Also abortion is repeatedly asking. Anemia repeatedly asking. In that physiological changes repeatedly asking. Normal labor, for the normal labor they are asking regarding third stage management.
First stage and mechanism of the normal.
Puerperal sepsis, all this is the expected essay question for your post BSc students, but BSc students also we can expect this one. So you can note down this one, repeatedly asking. You can expect this question also in a short essay part. Clear? Shall we move on to short essay?
So short essay, no need to explain
Yeah, we
much
will just
deeper,
list down
just
the
we will tell what are the things which will be
question.
there. So very first we will go with the list the complication of the cesarean section. What are the advantages? The next question is what are the advantages of and disadvantages of the vacuum extraction?
So you
Okay.
can see this vacuum extraction, it's same in the essay question, that is the applied forceps, like essay question you already discussed. In that same question they asked in the short answer, that is the vacuum extraction. And third question, that is explain about lowest manual
Explain about the lowest manual method. Manual
okay,
method.
so that you have to include in the short essay. And next question, that is diagnosis of occipital posterior position during the pregnancy and the delivery. And next question you can expect, that is explain about effect of diabetes on pregnancy. Clear? And next question, what we can expect, that is explain about mechanism of placenta separation. So note down, placenta is an important part. You can expect placental function also in the short essay question. What is the next question?
Role of nurses in infertility management, and the next question is medical termination of the pregnancy. That NTP Act is there, no? That is a legal act that you should, what are the objectives will be there, what are the measures the government of India has been taken, okay? So how the act will be rendered, all the things you cover with that. Next important is fetal skull. Okay, this is also very important, same like a pelvis.
Fetal skull, you have to include the diameter, parameters and the lobes. You have to study that one. Next question, minor disorders of pregnancy. Next one, sub-involution of the uterus. Next one, management of gestational diabetes. See, repeatedly the question is coming. And next question, diagnosis of pregnancy. And next one, management of obstetrical shock, management of pregnant woman with HIV. See, pregnant woman with HIV is also we see in the essay part. Now it asked in the short essay, that is management of a pregnant woman with HIV. What is next question? That is immediate assessment of a newborn. Did we discuss this question in the essay part? Yes, we discussed. So expect this one also in the short essay question. And what is the next question? Explain in detail nursing management of third stage of labor. See, important of labor is key. What is next? Explain the steps in baby friendly hospital initiative. What is next question?
See how much more within 5 minutes it is going to be wind it up. Post basic BSc nursing. Next we have
Next question, explain in detail about the physiology of lactation and mention the minor disorders of pregnancy and explain brief about the management.
And explain in detail about the antenatal care. That is why I am telling antenatal, postnatal, intranatal cares are the very important cares. You have to write what are the objectives, purpose, advantages, everything you write. Okay, the next one is
Next one, role of nurse in infertility management. Infertility also came here, and explain the functions of placenta. Say functions of placenta. My dear BSc students, this question also for you. Someone is asking, well, when it will start for BSc? Yes, you can.
wait,
You just see, once you watch this, all these questions we will tell you for your BSc questions. Okay.
So the next one is we have explain natural family planning methods that you know, and explain the causes and the rupture of the uterus. Already we have discussed that one. What are the functions of the placenta? That is very important. And enumerate the birth injuries of the newborn, and explain the physiological changes during the postpartum period. Explain the role of nurse management during the puerperal sepsis. Okay, that is also one of the important question. Define multiple pregnancy and state the clinical features of it and its complications. Develop the clinical teaching plan for antenatal women to prevent iron deficiency anemia. Explain the Burns-Marshall's method. Okay, so these are whatever the questions I have told in this short essay, all the things which we have discussed. Okay, so this is the thing which we can expect. Okay, these are all the very important topic which we have covered in the post basic BSc nursing. For now it is over.
And my dear Agila, Joy, Shiju, കൃഷ്ണപ്രിയ, നിങ്ങൾ പറയുന്നുണ്ട് 1 hour വേസ്റ്റ് ആകുന്നു, കാത്തിരുന്നിട്ട് കാര്യമില്ല. അങ്ങനെ ഒന്നുമല്ല മക്കളെ, കാത്തിരിക്കണം, സാധനം വരുന്നുണ്ട്. നിങ്ങൾക്ക് മാത്രം പറഞ്ഞുതരാൻ പറ്റത്തില്ലല്ലോ, നമുക്ക് പോസ്റ്റ് BSc സ്റ്റുഡൻസും ഉണ്ട്. സോ only discussing just 5 more minutes. BSc students, your question we will release now. Don't go പോയിട്ട് പിന്നെ വരാമെന്നൊന്നും പറയല്ലേ മക്കളെ, നിങ്ങൾക്കും ഈ ക്വസ്റ്റ്യൻസ് വരാം. Okay, so only last 5 minutes we are giving the very short answer question for the post BSc. After that we will start for BSc students. Okay, പോവല്ല് നിക്ക്. Okay, so we are going to very short answer questions for the post BSc student. What are that?
Post basic students,
We will only just explain the questions, not giving a elaboration. So we can
because fourth years no, they have already studied very well, and post basic also studied the same topic which we are going to discuss right now also.
Yeah, the first question, short answer. List the indication of episiotomy. Second one, what are the type of lochia? Define menopause. What is Oisland sign? List the barrier method of contraception. What are the aims of antenatal care? Define abortion and classify the type of abortion. Abortion is coming again and again and again. So note down, abortion is important. List down the type of pelvic. Define crowning. Crowning already ma'am explained. Next question. Write the clinical features of pre-eclampsia and eclampsia. Clear? And what are the next short answer questions? That is 2 contraindication for oral contraceptive. Define family welfare program. Define vasectomy. Mention any 2 difference between methadone and oxytocin. See, the drugs are in the questions. Next one. What is false labor pain? You may get, you can also expect false labor pain and true labor pain. Next one. What do you mean by bloody show? What is bloody show? That is the spotting. First pregnancy we can see the sign. And define episiotomy. What are the causes of precipitation of labor? Next one, ma'am, explain. Implantation.
Here we have the implantation, and see whatever we are telling now, that is short answer type of questions.
Only 2 marks. So write down the
axis pressure. Again lochia is again repeated, and we have monozygotic twins. Okay, what are my monozygotic twins? Exclusive breastfeeding. Regarding the exclusive breastfeeding and as well as the advantages, techniques, everything you write over there. Amenorrhea means absence of the menstrual cycle or the periods during the pregnancy. The next one is small or dead babies. Okay, what are small or dead babies? You have to write. And the reflexes, more important. Either they're definitely going to ask 1 reflex in the 2 marks. Okay, so the next one is curvatures, and we have a precipitation of the labor. Okay, that is what we are discussing right now. No, so all are short answer.
Next question. Write any 2
Write any two
permanent method of family planning. Define secondary infertility. Outline the drug used to treat eclampsia. Define stillbirth. Define shoulder dystocia. Shoulder dystocia is again coming. Define uterine inertia and
define
lightening. Write any two difference
Water
between
leakage.
true labor pain and false labor pain. See, again and again I'm coming. False labor pain and true labor pain. Okay, next one.
Next we can move with the
Yeah, again the remaining short answer, that is
don't be feel bad. You people are telling no, ma'am, fast you are taking. That is why we are fastly taking. What do you mean by cervical dystocia? Define the primary infertility. There they are asking the secondary, primary. Okay, so for that reason you have to know that both are important. List down the indications of the phototherapy and enlist the complication of the tubal pregnancy. That is what ectopic. And what is the recurrent abortion? Okay, types of abortions are very
Again
important.
coming abortion.
What is pica? Pica means unwanted things other than the food things the baby is eating, no? So that is what pica. This one we can experience in the pregnancy also. They wants to eat something else, like in olden days and all, they're telling no, mud and all they are eating. The
Next one.
define weaning. Okay, and what are the features of
Features of caput succeedium, like caput. It's from the caput that you can expect as a question. And next is the precipitation of labor. See, precipitation of labor, fourth time it's coming in the short answer question. So study well the topic.
What are the causes of vasa previa?
So next one, only 20 more questions, huh?
Again,
Lochia.
moral reflex repeated, and
Hyperemesis
gravidum, positive signs of pregnancy, neonatal jaundice. That phototherapy they are asking. Here they are asking the neonatal jaundice. Then list the objectives of the safe motherhood. List 4 advantages of colostrum. Okay, the first breast milk, and mention the types of episiotomy. Mention the benefits of vernix caseosa, and mention the types of placenta previa. This is one of the abnormal condition which we can see in the labor. Okay.
Last short answer, that is define hydratiform mode. List the longitudinal diameters of fetal skull. See, fetal skull in the short answer also there, short essay also there, in short answer also it's coming. And neonatal jaundice definition, then mention 4 indication for labor, and list down indication for vaginal examination. Define hyperbilirubinemia, what is unwed mother, define IVF. List 4 aims of antenatal care, what are the signs of crowning. Finish. These are the short essay for the post.
Short answers for 4 years. And one more thing I will tell, in this particular abnormal labor will come, no, abnormal disease conditions will come, no. For that reason, far short 2 care plans you put there and write the nursing management properly. That is helpful to you. Okay, so this is the thing you have to thoroughly know about regarding the paper presentation 4th years. Okay, especially I am telling both the post basic and the 4th years. Okay, this is the thing which you have to do during the year examination. Okay, hope you guys are understood very well, and this will may going to give a good marks in your next examination. All the best for everyone. Now we can wind up our session. Thank you.
So now we will start with the 4th year BSc students. So I know all the students are waiting, that are the 4th year students BSc. So Joelle, Akile, Prince, എല്ലാവരോടും തുടങ്ങാൻ പോവാണ്. ഇനി ഇറങ്ങി പോവരുത്, നിങ്ങളുടെ ക്വസ്റ്റ്യൻസ് ആണ് തരാൻ പോകുന്നത്. Okay, if you have any doubt, you have to comment in the comment section. See, don't miss any single section. Okay, so
we will go with the long essay type of question.
So all are start to write Because we are start to tell. So the expected essay question. Note down. First question we are telling for you, BSc students. First one.
Cervical dilatation admitted to the labor room. Identify the signs of second stage of labor, and the second one is explain the modified WHO partograph. Okay, regarding the partograph and their implementation and all, you have to write. Okay, the second stage of labor is very important. You have to write about that. The second question is identify the causes of PPH. Again, already we have explained.
Yes.
Okay,
That's why we are telling. Don't think this questions for post BSc students. We will wait for our section. See,
postpartum hemorrhage, and as well as explain the nursing management during the postpartum hemorrhage. Okay, and the short essay like we have the placenta, explain the placenta at term and differentiate between the gynecoid and android pelvis. Okay, the types of pelvis are important. Explain the antenatal exercises, whatever the antenatal exercises their mother should do, that you have to write, and enumerate the various pain relief measures during the first stages of labor. The next one, outline a discharge plan for a postnatal mother following normal vaginal delivery. Enumerate the minor disorders of newborn.
All the essay first. Then they can note down, no? So we will explain all the essay first and the short essay next. After that, very short answer. So you can write down everything. Okay. Otherwise it will get mixed up. Okay. So essay already ma'am explained. Explain, no?
Next one is define antenatal care. English the objectives of antenatal care. C type question is plan an antenatal educational program for the pregnant.
So you have to give a definition for antenatal care and what all are the objective you have given for a antenatal mother, and C sub question, plan an antenatal educational program. So you have to give a nursing intervention, management and antenatal program. Which program you are ready to give for a antenatal mother. Like that you have to answer for this question. Moving on to other essay question, that is cesarean. A woman, I will
define rupture of uterus.
No, the question. We will tell the question and the sub questions. Okay. A woman with previous cesarean section presenting with the complication of pain at the incision site and with the fetal distress of CTG. So while reading the question, you understand there is a what is there? There is a previous cesarean presenting is there. So that is a question indicating for the rupture of uterus. So first sub question, define uterine rupture. B sub question, outline the etiology of uterine rupture. Sub question C, explain the management of uterus rupture. See, this question also we already explained in the post BSc students. So detailedly we explained. We don't have any time to explain again. So uterine rupture is an important question for your essay. Next, we'll move on to the next essay question, that is define antenatal care and its objectives. See, again the antenatal question is coming. You have to define what is antenatal care. And sub question, what is the sub question? Explain
explain the antenatal educational program in an OPD setting.
See, before question also, plan a program for antenatal mother. Here a little different only there. That is the program setting is in the OPD. So OPD means outside patients are coming. So that time what is the educational program? What all are the educational advice you will give to a pregnant woman? See, third time repeating question is the antenatal mother. Clear? And what is the next essay question? Define cord prolapse. Okay, so you have to give a definition for cord prolapse, and sub question, write the clinical type of cord prolapse. So what all are the cord prolapse are there? Indication and the diagnostic everything you have to include. Sub question C, explain the management of cord prolapse. So management, what you will include? That is nursing management is there, medical management is there, intervention, everything you have to include in the management part. Then only you will get a 10 mark in the essay part. Clear?
Next one is define eutosia. Eutosia means labor, okay. Dystocia means normal labor, or dystocia means abnormal labor. So for that reason, the next one is first stage of labor. They are going to ask physiology of the first stage. Physiology means the function, whatever the work will be done in the first stage, that you have to explain. The next one, describe the management of third stage of labor.
Many are telling, please tell slowly. Speed കുറച്ചിരിക്കുന്നു. Okay. നിങ്ങൾ ഭയങ്കര ക്യൂരിയസ് ആയി നിന്നതുകൊണ്ട് ഞങ്ങൾ വേഗം സ്റ്റാർട്ട് ചെയ്തു പോയതാ. Okay. Sorry.
The next one is define puerperal sepsis. That's what we have already discussed. Okay, the next one, enlist the types and causes, risk factors of puerperal sepsis. C question is explain the medical and nursing management of puerperal sepsis.
Okay, one person commented SK Chittagan. Blueprint question. Is that no, this is not a blueprint question. These are the previous question. Because I am telling the students who are under Nursing Guru, who all using Nursing Guru app, they can pass easily because they are studying with this material. So those who not using this one, we are extra giving the information. Okay, this is not a blueprint. We didn't get any answer. We can tell this is our application. This is only our application. We are completely taken all the question, not for us, not for you. It's for you, not for us. So don't think it's a blueprint. It's a effort of other staff. They are preparing question. They are completely revising the syllabus, taking the important question, making the answer key, and we are explaining. Okay, don't. This is a blueprint. Okay, so we'll continue.
And one more thing, the blueprint questions you are telling, right? The Rajiv Gandhi University blueprint. So that blueprint only same questions will come. Okay, so that is what we are going to discuss right now. Next question we are going with the what are the causes of antepartum hemorrhage, and explain. B question, explain the management at 34th week of pregnancy with antepartum hemorrhage. Okay, and the second question, what are the causes of the puerperal sepsis? Again, the puerperal sepsis has been repeated. Describe the clinical features and management of the genital tract infection in puerperium. The third question we have, what are the complications of the breech presentation? Breech presentation already we have discussed. Okay, so it comes under the dystocia. So that you have to study thoroughly. Discuss the management of the breech presentation. See, this kind of things which we are coming, by the time like antepartum hemorrhage and all, or puerperal sepsis, by the time you add a care plans and the nursing management thoroughly in your examination.
Clear?
Next we can move with the define breech presentation and its types. Again, second, B type question, mention the maneuvers used to deliver the after coming head in breech presentation. Whatever the maneuvers we are using to deliver the baby after the breech presentation,
that already we explained in the first question of post PC, that are the applied force application. So there are certain application are there, vacuum are there, forceps are there that are used to deliver the baby. So the question we already discussed. You can revise the video from the initial. If you want to specific answer from each question, it's there, because repeated question it's difficult to explain the answer repeatedly. That's why we are just going through the question. Okay,
the next one is second question, define postpartum hemorrhage PPH. And the third year only, B, list the causes and risk factors of the primary postpartum hemorrhage. Explain a medical nursing management of atonic uterus in the PPH. This is also already we have discussed. The next third one, define ectopic pregnancy. This is very important. For sure they may ask for the 10 marks. Ectopic pregnancy, this kind of things will come by the time you thoroughly explain the management. Define and enlist the causes, risk factors and diagnosis of ectopic pregnancy. Explain the emergency management of the ectopic pregnancy. Okay, so this is very important in the long essay. The next one is explain the structure of the placenta. at term with a neat label diagram. This is very important. Placenta diagram and its functions of the mature placenta, and mention the anatomical variations of the placenta. Regarding the placenta, one question has been arised. This is one of the very important question also. Define gestational diabetes mellitus. Sorry.
Again coming diabetic mellitus. GDM. So at last we will just write all the important questions from the essay part. Don't worry, if we are telling fast, don't worry, we will just write down the important essay question in the board. Okay, so don't need to worry.
Explain the structure of the placenta, that is over, right? Next we can go with the define placenta previa. Okay, the abnormal labor, placenta abnormal condition. Okay, the next one, types of the placenta previa. Describe the management of the mother with the placenta previa. Next question, very important, define preterm baby. This is very important, for sure they will ask. Then what are the characteristics of preterm baby? Explain the role of nurse in the care of preterm baby in the neonatal intensive care unit. Okay, this is also one of the very important. Next, these are the very important when it comes to the
also explain. Okay, so all the essay questions we just completed, and we will just note down in the board, so you can also write down the topics. What all are the repeated question also we will just explain. So students, you just note down all these things. So the first question that is from active stage of labor. Okay.
active stage means active stage of labor means
stages of labor, like that we get. So stages of labor is an important topic. In that, first stage labor is there, second stage labor is there, third stage labor is there. Same you can study as a management of third stage labor. In that, the important one is this partograph. Okay, so and the second essay question, that is a PPH. Okay, so in that, define what is PPH, right? What all are the causes indicating PPH, and also the management of PPH. Clear? So now I explain two essay questions. First one is the labor and second one is the PPH. Clear? We'll move on to the next essay. Yeah, long essay question. We are discussing the long essay question. You can note down the question. Next one, antenatal care. Antenatal care. Antenatal care is the question, but you can expect intranatal care. That intranatal care is the first and second and third stage of labor. Postnatal care is the postnatal management. So the question, you can expect antenatal care. In that, objectives, also educational programs. Clear? Next one, we can expect that is a uterine rupture. What is uterus rupture? You have to give a definition for uterine rupture. And what is the etiology? What are the reason for the uterine rupture? There is a previous cesarean and any tenderness in scar. All these factors can lead to rupture the uterus. And what will be the sub question for that? Management of the rupture uterus. So include the management. What are the management you have to be taken care? That is IV management is there, surgical management is there, nursing management you have to include. And next question, that is antenatal care and its objective. See, second time the question is coming, so we will put one plus mark. Antenatal, antenatal question again coming. So antenatal care and objective is a repeated question. Next one, define cord prolapse. So you have to study what is a cord prolapse and the clinical types of cord prolapse and the management. Clear the question? What is the next question? That is define
Antepartum hemorrhage.
Okay, so the antepartum hemorrhage is a important topic in that. What all are the
See, if
types?
you are study PPH, no, so there only it will come postpartum hemorrhage, antepartum hemorrhage. Both you study, differentiate and study. That will definitely give you a good knowledge also. Okay.
And the physiological changes. Physiological changes. Mainly the important one is the cardiovascular system. What all are the changes happening in the cardiovascular system you can expect. Also breast changes and also changes in the first stage of pregnancy. What all are the physiological changes we can expect in the first stage of delivery. Also I expected question from this part. And puerperal sepsis. Is that we written?
Yeah.
Okay. See, puerperal sepsis also repeated question. In that, important thing is the management. Management means medical management, nursing management, surgical management. Everything, each and everything you have to include in your essay part. Then only you will get a good score. Don't skip any single point. And what will be the next question? What is the cause of antepartum hemorrhage? See, again PPH is coming. Antepartum hemorrhage, we have to answer the question, the causes, the management, everything you have to be answer for the question. Next question, that is the puerperal sepsis. See, puerperal sepsis also repeated question. Again it's coming. And what is the next one? Complication of breech presentation. So we can expect breech presentation in a essay question. Also we can expect this in a short essay question. Clear? And what is the next question? That is postpartum hemorrhage. I don't know. I am telling this postpartum hemorrhage as a fourth type. See, 4 times repeated question in each question paper. Postpartum hemorrhage. So, study well. You can also expect this question in your exam sheet. And next is what? Explain the postpartum hemorrhage. You have to be mention the management, medical management, surgical management, nursing management. And after that, next question, ectopic pregnancy. Ectopic pregnancy also a important question. The management also they will ask in a C part. Define what is ectopic pregnancy, what all are the clinical features, what is the diagnostic measures and the management. What is the management you can give to a mother with ectopic pregnancy. And what is the next question? That is define gestational diabetic mellitus, mother with GDM. Define what is GDM and the causes, the clinical features, the diagnostic measures and the management. What is the management we can give to a mother with GDM? There is medical management and nursing management and also nursing intervention also you can include. Then next question we can expect, that is a we can expect preterm baby. From the preterm baby part we can expect question like characters of preterm baby, explain nursing role with the preterm baby. We know preterm baby means the baby delivered before 38 weeks, like 37, 36. So we have to give intensive care for a preterm baby. Okay. And next question is puerperium. So puerperium, in that what will be the question? In that question you have to define what is puerperium and what is the management we can give. Puerperium part you can expect many other questions, that is puerperal sepsis, puerperal pyrexia, everything you can expect from the puerperal part. And what will be the next question? That is placenta previa. Okay, placenta previa we already discussed in the first live section. That is, there are certain disorders of the pregnancy type like abnormal pregnancy. So in that not only placenta previa, you can expect abruptio placenta also. So what is the causes? What all are the clinical features? What is the symptoms of the placenta previa that you can expect from the question. So I hope all are clear with these questions. So I will just conclude for your OB-GYN with the essay part. See, once you study, you need to study with antenatal part, intranatal part, and postnatal part. Okay. First, take the antenatal period. In the antenatal period, what all are the things you can include? Antenatal assessment and the antenatal educational program. What all are the minor disorders in the antenatal period? In that, what all are things coming? Hyperemesis gravidarum, that is a condition. So what are the management of hyperemesis gravidarum? You can expect as a question from the short essay. And what all are the things you can include in the antenatal period? There is risk. Okay, risk pregnancies are there. Abortion, that also coming in the antenatal period. You can include type of abortion. What all are the type of abortion? Maybe you will get single question like what is incomplete abortion, what is complete abortion, what is threatened abortion. So you have to study thorough regarding each type of abortions. Clear? So that are the abnormal pregnancy or complication of pregnancy you can include in the disorders. Also, the abnormal pregnancy you can include placenta previa, abrasio placenta, and pregnancy bleeding in the early pregnancy stage. Clear? In that the spotting, everything you can include. And other than that, what all things in the antenatal? There is a disorders like GDM, hypertensive mother, also eclampsia, preeclampsia. Clear? So you can include the important disease condition in the antenatal revision period. Like preeclampsia is a repeated question, and preeclampsia also repeated question. The causes, the management, very important thing, the management of a eclampsia or preeclampsia mother. Then what all are the things we can include in the antenatal mother? Health education, we can include the health education in the antenatal mother. And other than that, we can include dietary management, anemia. The anemia also coming in the antenatal period. How to prevent anemia, what are the management we can give to a mother with anemic. So this all are coming in the antenatal question. Then we'll move on to the intranatal mother. Okay, intranatal mother, what all are the things coming? Just think, what all are the things coming in the intranatal period? Intranatal means the active stage of labor, right? Active stage of labor, mainly the expected essay question, that is the labor. Clear? You have to study regarding what is the labor, the stages of labor, first stage, second stage, and the third stage of labor, and the management of third stage of labor. In that you have to include regarding the puerperia, episiotomy, newborn care, immediate nursing management, and immediate nursing management of a newborn, also PPH. Clear? These all topic you can include in the intranatal mother. And going on to the postnatal period. Postnatal period, what is the topics are you can include? You can include postnatal care, education, health education for a mother with postnatal period. Also puerperal sepsis, puerperal pyrexia, and abnormal bleeding, PPH also you can mention in the postnatal period study time. Also the hemorrhage is coming in that. These are the mainly expected questions of essay. Clear? Any doubt regarding the essay questions? And yeah, these all are the long essay questions. Clear? The 10-mark questions are we explained now. We didn't move on to short essay. All these explained part are for the long essay. Clear? Any doubt regarding this? Just explain. Okay, we are getting more questions. ഇത് വല്ലതും ഇതൊക്കെ ഉള്ളതാണോ? യെസ്, ഇതൊക്കെ ഉള്ളതാണ്. ഇഫ് യു വാണ്ട് ദ പ്രൂഫ്, ഐ വിൽ ഗിവ് ദ പ്രൂഫ് ഫോർ ദ പ്രീവിയസ് സോഷ്യോളജി എക്സാമിനേഷൻ. Okay, so clear regarding the long essay. We'll move on to short answer. Okay, So we'll move on to the short answer question. You can note down. The first expected short answer question is explain the placenta at term. Okay, so placenta question, you have to expect the functions of placenta. Functions of placenta, you have to point out and elaborate the functions of placenta. Second question, differentiate between gynecoid and android pelvis. So pelvis also important topic. We can't predict which part will be. They will ask for your exam. So now they ask differentiate between gynecoid and android pelvis. Clear? Third question, explain antenatal exercise. So before I told antenatal period, health education, you have to study. Also they asked regarding antenatal exercise. There is Kegel exercise and many certain exercises are there. You have to point out and elaborate. Then you will get the score of 5. And next question, enumerate various pain relief measures during the first stage of labor. So first stage of labor, there are certain medications. So initially we are giving paracetamol and there is diclofenac, and only the don't write oxytocin and methotrexate in this answer, because all this medicine we are giving in the active stage of labor only. So do not write as a mistake. You don't get any answer. Okay. If you don't know anything, just simply write a paracetamol. Okay. So you can write this question. Next question. Outline a discharge plan for a postnatal mother following normal vaginal delivery. Okay, so postnatal educational question they asked. You can include what all are the postnatal care we can give. Write down what is the perineal care, how they have to follow a perineal care, they have to clean the area, they have to follow infection free technique, then only it will be prevent perineal infection. So educate them how to do perineal care and importance of taking the dietary products, because after the delivery the nutrients help to produce the milk production. Okay, the lactulose production, they have to be include many things to improve the milk production. Clear? And also they have to continue the iron and calcium medicine to give a bone density, to improve the bone density. Clear? Next question, describe the management of hyperemesis gravidarum. See, hyperemesis gravidarum is the question I already explained. So what will you write as the answer for this? We have to give a short type of food. She should not take heavy food. She has to take the food in a break time, like finger food. Okay, so she has to drink more water, IV fluid therapy, and the management or diagnosis, we can do the urine analysis test. If she have the ketone plus more than 2 or 3 or 4, we have to start the IV therapy. Okay, once the ketone body get negative, the hyperemesis gravidarum mother will get a relief from the vomiting. Clear the answer? Like that you have to discuss the answer. So we now discuss 1, 2, 3, 4, 5, 6, 7. Okay, 8 question now we discussed. We'll move on to next remaining short essay questions. First one is draw a neat labeled diagram for uterus and explain its function. So you have to draw the uterus and you have to write the functions of the uterus. Next question, explain the principal movement of labor. So labor again came as a short answer question. You have to write down the principles of labor. Next one, explain the adaptation of newborn to extrauterine life. Clear? Next question, differentiate between placenta previa and abrasio placenta. See, the question is coming as a differentiation. So placenta previa and placenta abrasio is important question. You may get separate and also you may get in a differentiation. Next one, explain about cause of neonatal jaundice. Okay, there is physiological causes and pathological causes are there. Pathological jaundice also there. So you have to mention what all are the causes and the management. Next one, define infertility and explain causes of female infertility. We already discussed the infertility essay question detail
in the post BSc section, and the courses they clearly asked for female. There is both courses for men and female. So female question they asked what are the courses, maybe PCOS, maybe PCOD or tubal disorders. All this can cause to infertility in a female. Next question, describe the management of mother during postnatal period. So what is the management? We have to give a postnatal period. Postnatal means after the delivery. So write down the management. Next set of question, describe the development of placenta. See, placenta is again and again coming. So describe development of placenta. Next one, describe the psychosocial and cultural adaptation during pregnancy. Okay. Next one, explain the physiology of lactation. Lactation is an important topic. You have to study well the physiological changes in the lactation and the lactogen production, hormonal effect, which hormone is helping to produce the lactose, everything you have to include in this topic. Okay, next one, enumerate the neurological assessment of newborn. Newborn assessment you have to write. In that what will come? The Obg score will come. The initial immediate management you have to write down. Next question, write a brief note on asphyxia neonatum. Next one, explain the role of nurse in a family planning counseling. So that is a education question. You have to point out what all are the education you are giving for a planning, family planning couple. So you have to explain what are the family planning method. There is permanent method and there is temporary method. Maybe you will get a question that what all are the permanent family planning method, elaborate it in detail. So study permanent family planning method and temporary family planning method. Next one, next short answer question, short essay, that is enlist legal and ethical aspects of midwifery. Write any two in detail. So study the ethical and legal aspects of midwifery. Next one, describe anatomical features of the fetal skull. See, the fetal skull question also we discussed in the postnatal post-basic student. In that you have to include what? The diameter, the parameter, the frontal layer, how many lobes are there, what all are the diameters of the fetal skull. You have to give a elaborate answer for this. Next one, illustrate cardiovascular changes in pregnancy. See, physiological changes of pregnancy, they specifically ask the cardiovascular system. Clear? So you have to study cardiovascular system in detail because they will ask in essay part, also they will ask in a short essay part. Next one, describe management of threatened abortion in first trimester. Which one they asked? Threatened abortion. So abortion also important topic. I already mentioned. Maybe they will ask complete abortion. Maybe they will ask incomplete, threatened. There are certain classification for abortion. So we can't predict which one will be, only they will ask. So now they asked threatened abortion. So you have to write the management of a threatened abortion. Next one, explain the management of neonates with explain the neonatal management. And next one, explain the vitro fertilization. Vitro fertilization, that is the treatment for the IVF. So you have to study the management of fertility. There are certain management, medical management, there are certain medical treatment also there for the IVF, tubal pregnancy. In vitro fertilization is there. So study detail, we can expect anyone for this question. Next one, describe medical and nursing management of eclampsia. Eclampsia again coming as a question. So medical and nursing management, first you have to write the medical management. Second, mention what all are the nursing management you have to be given. Next question, explain permanent method of family planning. See, before I told, maybe they will ask family planning. They asked. So study the family planning, permanent method and temporary. Okay, there is oral contraceptives and pills, condoms, everything coming under the temporary family planning. Permanent family planning method, what all are coming? There is surgical management, that is for men and women are there. Tubectomy is there, vasectomy are there. Okay, so you have to be list down the classification under each family planning method. Clear? Okay, next one, explain okay, that we already discussed. Next one, explain the diet during pregnancy. Okay, very easy question, no? Diet question you will ask, how you will answer? We already discussed regarding to prevent anemia. We have to include more iron rich food, more calcium rich food. So they have to be include more vegetarian food, more iron rich meat, and there are nuts, everything is there. So dietary management is very important for a antenatal woman. So you have to include the dietary management. What all are the food they have to be avoided? They have to avoid spicy food, Coca-Cola, and many drinks they have to be avoided. So classify like that and elaborate your answer with the dietary management. Next one, describe the functions of mature placenta. See, again and again placental function is coming. Next one, explain non-stress test. That is, while the pregnancy time we are conducting the test, that is the non-pregnancy non-stress test that they ask for 5-mark question. Next one, explain any 4 tocolytic drugs. Okay, so drugs very important, you have to be study. There is oxytocin are there, methotrexate are there, many drugs coming. You have to study 4 and the usage, the dosage, everything you have to be study. Next one, define kangaroo mother care and its advantage. What is kangaroo mother care? That is the mother and baby bond. We are keeping the baby in the mother chest, and the what all are the advantages? If the baby is preterm, the kangaroo mother care can increase the baby weight and the mother baby bond. Okay, like that you have to answer this question. And next one, define threatened abortion and the nursing management of a mother with threatened abortion. See, threatened abortion, third time they are asking. So note down, threatened abortion is an important question for your examination. Next one, define the resuscitation of a newborn. Okay, newborn resuscitation you have to be study. Next one, list down the indication prerequisites of the procedures of the vacuum extraction. You know already, we already discussed. There are certain application we are used to deliver the baby. There is vacuums are there. There is forceps are there. So that you have to study. They will specifically ask any single equipment. Next one, list down the indication for okay, that we already discussed. And next question, describe the causes of female infertility. See, again the question is coming, female infertility question. So you have to study the causes. What is the causes? COPD, sorry, PCOD, PCOS, and tubal problems. Okay, so repeated questions I am telling means you just mark which all questions are repeatedly came. So you can easy to study all this one. Next questions, explain the role of nursing in the family welfare program. So family welfare program means what? Family planning, the health education, what all are the method, what all the welfare program under the WHO. You have to list down and you have to elaborate in detail. Next one, describe the procedure for surgical method of induction of labor. What is the surgical method? That is LACS. What is the indication? As we all know, if the baby have any distress, if it's the delivery is prolonged labor, any complication, PPH, any uterine rupture, there are certain complications are there. So you have to list down the fetal factors are the indication and the maternal factors as an indication. Next question, illustrate the nursing management of a low birth weight baby in ICU. Low birth weight baby means the preterm baby. So the management you have to mention on the neonatal care for a baby with a preterm. Next question, explain the medical and nursing management of urinary tract infection in postpartum. See how the urinary tract infection came in postpartum due to why? Unaware of the safe practice. After delivery, the episiotomy site should be clean and neat. They have to follow infectious precaution, otherwise that can lead to many other complication. In that they are specifically that is urinary tract infection. Clear? Because you know where the episiotomy cut is there putting. Okay, so study that question thoroughly. Next one is the explain the nursing responsibility in maintaining the partograph. See, partograph you got as a essay question. So they again ask this question in the short essay. Next one. Describe the role of nurse in management of teen pregnancy. So teen pregnancy is very important topic. You have to write the management. What all are the management we can include in the question. Next short essay, that is explain detail about the development of placenta from conception. See, placenta again and again they are asking, so study the placenta function, the placental development, development from the conception period. Important, very important. You can expect this question. Then next what are the short essay question? How will you prepare the couple for parenthood? See, parenthood question is a essay question. They ask this question in short essay also. So study well the parenthood topic. Next one, explain about the antenatal female reproductive system. So if you have time, you have just draw the uterus, or you can write down the functions, everything you can include in this topic. Next, describe cardiotocography, like CTG. There are the monitoring for the fetus that you have to study well. Next question, what are the physiological changes during second stage of labor? See, again they are asking the physiological changes. So study physiological changes in the first stage of labor, physiological changes second stage of labor, physiological changes in third stage. Okay. Next one, what is the primary postpartum hemorrhage? Explain its causes. PPH they are asking, and the causes. Explain what is PPH, what is the causes, explain causes in detail. Next one, how will you assess the obstetrician in management of a complicated breech delivery? So breech delivery they are asking, give a definition for breech delivery and the management, how the delivery will happen. In that you can include the application of the force equipments. So they are using certain kind of force equipments to deliver the baby. In that you can include the mechanism that already we discussed in the previous section. What is the next question? Write a brief note on meconium aspiration syndrome. What is meconium aspiration syndrome? Meconium that is aspirated by the baby and that can lead to distress for the neonate. That management you have to be study well and it will be in your question paper. Next part of short essay question, that is describe the management of third stage of labor. See, the management of third stage of labor, again they are asking what are the aims and objective of antenatal care. Next one, describe the perinatal management of mother with AIDS. It's already in the essay question. Management of mother with HIV or AIDS, it's already there. Next one, explain the structural abnormalities of placenta. See, placenta coming again and again. Describe the dilation and evacuation procedure, that is D&C and D&E. Explain the temporary family planning method for the female. What all are the temporary planning? That is pills are there, condoms are there, and the devices IUDs are there, and the that all are coming in the temporary family planning method. Next question, describe the role and responsibilities of a midwife. List down the role, list down the causes for infertility in male and female. Next question, explain the puerperal sepsis in detail. So these are the questions for short essay question, and we have short answer, 2 more questions also that we will discuss after some time. Okay, so I think all are clear. if you have any doubt, you can ask to us. So why we are telling that download Nursing Guru means everything, all these questions in these things. Okay. So in addition, we are telling this all questions. If you have any doubt, just comment in the comment section. So many of them asking that the blueprint question. So these are the previous question we can predict for your examination. Okay. Don't worry, there are many of them telling these are lot of questions and not able to finish like that. Not like that. If you're studying in one topic, there is many subtopic also there. So study all that one, and all the best for your exam. So that's all regarding the questions for the BSc Nursing students and post BSc students. I expect all you understand all these topics. Sometimes we explain it in a speed, and some student telling don't go with speed, tell slowly. So we tried our maximum, and we will try to improve it all. Your comments is very important. That's why we will improve it everything. If you have any question, you can message us. We will clarify you all time. We will with you. Follow Nursing Guru and update with us. All the best for your examination. All the best for the post BSc student for your examination, and GNM BSc students, you have 2 more days. Okay, 17th your exam, but you have 2 more days. So prepare all these questions and answer well, and we need to get a good review from your side. Okay, so that's all. Thank you. Tomorrow also we have a live section for the same GNM students regarding the OB-GYN. So we will see tomorrow, and BSc students, you can also watch that live, because same these questions in the GNM students also. So don't miss the live for tomorrow. We will come back tomorrow.